Miss Vakaronessa, 27 years old, unmarried female, studied up till graduation, resident of Gujarhan, admitted via OPD 20 days ago with a presenting complaint of oral ulceration for the last 20 days and red blood rash on formation on the finger and the toes for the last 20 days associated with pain. Patient was according to the patient, she was in real state of health in 2008. Then she noted a small pinpoint red raised lesions with a white scale on her nose that gradually increases in size to the size of the coin in a duration of almost 10 days. Mm, and the scale was white in color and it was semi-adherent. It was associated. This rash was associated with pain and burning sensation on exposure to sunlight. She had taken some topical treatment for these complaints from a local physician, but her symptoms never settled. Later on in 2010, she developed red pea-sized lesions in the pulp of her finger and the toe that gradually increases in size and later on become vesicles that contain clear fluid that rupture on their own and with oozing of the clear fluid, leaving behind areas of denuded skin. They were associated with pain, which was severe in intensity and was relieved by taking painkillers. She gave history of the transition of color from white to blue to red on exposure to cold. Then she also had a history of on and off history of fever that is high grade, documented up to 104 Fahrenheit. But she didn't give history of any localizing symptoms with the fever. According to the patient, her disease remained progressive. She had remissions in 2021 and till 2023 with the treatment. Now, this time she presented with oral ulceration for the last 20 days, involving whole of the oral mucosa and leading to difficulty in eating and leading to difficulty in eating. And she also gave history of exacerbation of pre-existing skin lesions on the finger and the toes for the last 20 days. She had a history of burning sensation on exposure to sun, which was relieved within 5 minutes after coming to shade. She denied any history of drug intake prior to these complaints, and she had history of taking of Primolut and tablet for 1.5 years for menorrhagia. Then in 2012, the patient complained of arthritis that started from the right ankle and later on it tend to involve the left ankle joint and then the knee joint, and also involvement, and she gave history of involvement of the small joints of the hands. She gave history of swelling and erythema and morning stiffness of 10 minutes, and her stiffness improved with activity, and she can perform her daily activities. There is no history of any bullous lesion, and there is no history of violaceous net-like mottling, and there is no history of painful wheal formation that take more than 24 hours in healing, and there is no history of painful nodule formations on the leg, and there is no history of sudden swelling of the leg associated with pain. There is She gave history of decrease in the loss of scalp hairs and loss of scalp hair, but she denied any history of ulcerations in the genital and the nasal and eyes. She gave history of discoloration of the nails, and there is no history of thickness of the skin or difficulty in opening the mouth. There is no history of regurgitation of food. No history. She complained of some difficulty in standing from sitting position, but she can do her daily activities. She can button and unbutton, and she can wear the shirts easily. No history of gritty sensations in the eyes, and she don't need a sip of water to swallow the food. Then there is no history of intake of any homeopathic and chemic medications, and her skin biopsy was done once in 2012, but she didn't know the report. Then she had been taking tablet delta cortical 30 milligram, but there is no history of raised BP, polyphagia, polydipsia, weight gain, increased hair growth, or visibility of the prominent veins. And she also gave history of intake of tablet HCQ, 200 milligram daily, but there is no complaint of discoloration of the skin or the nails, and she didn't give history of any eye complaint of eye symptoms. She also took a tablet methotrexate. Initially, according to her, she took 2.5 milligram tablet, 6 tablets per week. But now she later on her dose was reduced to 10 milligram per week, and she also gave, but no complications were observed with this with methotrexate, like jaundice or any kind of decrease in the cell counts. She also took tablet omeprazole and some calcium supplements along with this. There is no history of headache, blackouts, dizziness, no history of chest pain, palpitation, swelling, or any. But there is history of darkening of urine, but there is no history of frothing of urine, for which her skin biopsy was done. Mm, and but biopsy report was awaited. She also gave history of pulse therapy, and it was stopped because of some unknown reason. She don't know why the pulse therapy was stopped, and there is no history of any biologic intake. There is no significant surgical history, and she is non-smoker, non-addict, and she lives in their own house with her siblings and parents, and her father is the sole earner, and belongs to a lower socioeconomic status, and there is no history of TB, hypertension, diabetes, or similar kind of illness in any of the family members.